Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnameneha kihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Wapoose. On this episode, I'm joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. Welcome, Vaughn.
Hi there, Sheena.
So, we'll first go over our listener-submitted question that we got this week.
Those are the best.
So, I'm going to try my best with pronouncing this. So, does Sinupret block endoviruses before replication? Is the question.
Okay, so I actually had to look this up. I wasn't sure if Sinupret was a new drug that was on the market or what it was. So, from what I understand, Sinupret's actually it's kind of a compilation of herbal remedies. So it's sorrel herb, elderflower, primula flower, verbena, I think is how you pronounce that one, and gentan, I think is how you, gentan root. She is nodding her head. I hope she understands what that is. I don't know. Anyway, so it's actually been used in this combination for like 70 years over in Germany. They use it all the time, particularly for treating things like sinusitis, which is when you have an inflamed sinus. Unfortunately, you know, it does seem to have some clinical benefits. They've done some studies on it, and it does seem to have, you know, antibacterial properties that they can identify, and so they alleviate symptoms of, you know, sinus infections. Unfortunately, those studies haven't been able to demonstrate its ability to, you know, affect viral replication or anything like that. So I would have to say no. And additionally, on the label, there is a warning that says this product's not intended for diagnosis, treatment, or cure, or preventing of diseases. Food and Drug Administration has not evaluated, you know, any of the above statements that, you know, of course, it makes on the box about how it'll change your life and make you grow 6 inches and jump higher and all that great stuff. But it is used regularly for sinus infections, but not viral infections. Sorry, everyone.
Okay, so this week, the big news was that the Pfizer vaccine is now fully approved by the FDA. So what does that mean exactly, and how does that differ from its status before?
So before, the Pfizer vaccine had an EUA, which is emergency use authorization. Basically, that means the FDA found, in this case, the Pfizer vaccine to help with the diagnosis, treatment, or prevention of a serious life-threatening condition. In this case, it was COVID-19, and they're like, yes, the vaccine does help. We're going to give it approval and stuff, a temporary approval. So to get an EUA, it had to go through a phase 1 trial, which is they give the vaccine to healthy people to see if it has any sort of side effects or causes any, you know, harm or whatnot to them. Phase 2, they is similar to phase 1. They give it to healthy people, but they change the dosage levels. And in phase 3, they make it a larger randomized trial. They try to make the demographics as broad as possible so it can represent, you know, all the majority and minority populations in the country. And if they can bring that back with definitive data suggesting that it will prevent and or treat a virus that is life-threatening, it can get an EUA, which it has done in this case. For full FDA approval, it's basically just getting all your paperwork in order, if that makes any sense. They have to do, you know, additional studies with, you know, tens of thousands of additional participants. They have to track at least 3,000 participants for at least 1 month to see if there's any sort of adverse reaction to the vaccine in this case. They also have to compile all of their safety data with at least a 2-month record. And then they also have to be able to demonstrate that there's sufficient quality control for manufacturing, distribution, and also that they're making improvements to safety and stuff. So it doesn't really change how it's used. It just changes the status by saying we have more proof and we're showing that it's safe for everyone to use long term.
So why was Pfizer fully approved but not Moderna or Johnson & Johnson?
It's not that Moderna and Johnson & Johnson won't be approved. It's just that they're not as far along in some of their trials, and I would assume filing some of their paperwork in this case, because it's been shown that the Moderna vaccine has, great results, fewer complications than Pfizer. It's much more effective than Johnson & Johnson. It's not that they won't be approved; they just haven't made it there yet.
Gotcha. Okay, so I came across a lot of people talking about Iver Medicine. So can you talk about, people are taking it to treat COVID-19. So can you talk about its efficacy and safety?
Yes. So Iver Medicine, hot button topic, kind of like hydroxychloroquine. Hydroxychloroquine was for a while. And so here's the thing. Iver Medicine is a fantastic medication. It's been out in wide distribution. In I believe it was 1987. They distributed over 3.7 billion doses globally, and the reason for it is it had two great effects. It was an anti-parasitic, and it was cheap to make. But in addition to that, it was incredibly safe. The World Health Organization actually listed it as a model drug for its safety record. And it's been widely distributed through parts of Africa. It's helped with all kinds of parasitic diseases, really helps reduce inflammation in the eyes and the ocular cavities, and prevented some pretty heinous diseases that were causing blindness over there in the adult population over the age of 40. That said, they started doing experiments back in 2012 with it to see if it had antiviral properties as well. Those were looking really good, and they found that it blocks a cytokine storm in a person. So that's the main problem that COVID-19 currently causes. So why is this a problem? Because there were some people that were going to veterinary clinics and whatnot and using the doses that were meant for horses rather than people. Don't do that. I'm not a doctor, but I can say don't take horse tranquilizers, horse antibiotics. The dose is not right for you. But they have been doing studies they've done roughly 50 to 60 studies at this point throughout Israel, India, other parts of the world, and they've had really good success with treating COVID-19 with Iver Medicine, but it hasn't been approved by the FDA, so we can't use it here in the United States for that reason. So that might be what the hubbub's about. It works. We haven't filed the paperwork for it properly to do it here in the U.S.
And just to reiterate, it may work, but it's not safe to go and buy from the veterinary or
Correct.
Tractor Supply
Correct.
or whatever.
Do not go to Tractor Supply
that.
and get it.
Okay. So where are we right now locally with our case numbers and in comparison to when we were at our highest?
All right. So Dr. Schlegel, our fantastic medical expert and stuff, who's our lead on this, has been looking at the numbers. Right now, we have about 19 positive cases. And those cropped up over the last week. Since the 24th, I guess 3 days ago, we had 2 new cases. But it's not as high as it has been in the past. Right now, we are at, the best way to describe it is we're kind of where we were last fall, about this time actually too. And that doesn't sound great because we had a giant spike in the winter. However, due to the vaccination process that's been going on, ThedaCare has been running a lot of models on the projections of how they think it's going to trend locally, and they're thinking we'll probably peak in September, hopefully. So that could be good news. And they're thinking early September. So hopefully this is going to be the worst of it this time around. And the vaccinations that we've been doing are going to be extremely effective. While talking about vaccinations, want to give a shout out and thank everyone. We've given out, another 575 doses in the first few weeks of August, which is absolutely fantastic. Just about every single demographic we have on the reservation has at least 63% vaccination. That's our lowest. If you're looking at our elderly population, and when I say elderly, I mean from ages 35 to 65, that is basically in the high 80s to 90 percentile for vaccinations. So our elderly are doing really good. Our youth that are 12 to 17 are also doing very good. 12 to 15, they're about 80% of our population has been vaccinated that way. So that should really help with things like our back to school, which I find pretty encouraging. We have had some of our elders that got sick. Our oldest active case right now is a 77-year-old. Our youngest one is a 2-month-old. So it can still affect people. We've had breakthrough cases on the reservation. There have been 16 to date. However, the people that have gotten it haven't spread it to their families in most cases. So it is a good sign that the vaccination is working and stuff to prevent widespread of the disease.
Okay, so back in the fall or winter of last year, we talked about the younger age group having the highest infection rate. Is that
right.
Still true now? Yeah,
it's pretty stable. Kind of a toss up between those who are right around the ages of 18 to 34 statewide have the highest infection rate right now. Makes sense. That's kind of the lowest demographic that has for vaccination rates. That's correlation, not causation. Just going to throw that out there, everyone. We can't point a direct finger at that very thing. But that's a highly mobile group. They interact with a lot of people on a regular basis through work, school, and things like that. So it's understandable that the disease would be passed quickly through that age group. So.
Okay, so do you have anything else you want to share before we end the episode?
I'd just like to thank everyone for helping out, getting vaccinated, and making choices that are helping to keep everyone in the community healthier. I really appreciate that. So thank you. Thank you, everyone.
Thanks, Vaughn.
You bet.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab, and keep up to date by following us on Facebook at MITW Podcast. I do weekly updates with Vaughn. Welcome any community questions you have regarding COVID-19, so please send those to us at podcast@mitw.org.